You wake up with a very dry mouth. Your vision is blurred. There is a dull, deep ache in your abdomen like someone punched you from the inside. You look down. A long, neat line runs across your stomach. Stitches, surgical tape, a scar that was not there yesterday. Someone cut you open while you were unconscious. They moved your organs. They stitched you back together, and you let them. You signed a form and lay down and trusted a stranger with the inside of your body. You do not find this strange. You should, because for most of human history, what just happened to you was impossible, not difficult, not rare, not dangerous. Impossible. If you needed internal surgery 300 years ago, you did not get a scar. You got a grave. So how did we get from there to here? There is a single moment in human history. One desperate, insane decision, made by someone with no training, no understanding of infection, no concept of pain relief. But they made that very first cut. And it worked. By the end of this video, you will know exactly what that moment was. And you will never look at a scar the same way again. About 100,000 years ago, you are lying on cold stone. Your head is pounding with a pressure so intense you cannot see straight. Something is wrong inside your skull. You can feel it pressing outward from behind your eyes. The healer kneels beside you. In their hand is a piece of sharpened flint. You do not know what they are about to do. You do not have the language for it. But you know you are dying, and they are the only person who has ever made anyone stop dying. So you let them. The flint presses against your skull. And they begin to drill. This procedure has a name, trepanation, and it is the oldest surgical operation in human history. Archaeologists have found human skulls from every inhabited continent, Peru, France, Russia, Africa, all showing the same thing, deliberate circular holes, cut by hand, with stone tools. Some of these skulls are 10,000 years old, and here is the part that should stop you. Some of them show bone regrowth around the edges of the hole, which means the person survived. Someone drilled into a human skull with a piece of sharpened rock, and the patient lived long enough for the bone to begin healing. How did they know to do this? They did not. They noticed something. Over years of watching people die from head injuries, someone made a connection so basic it barely counts as medicine. The pressure is inside the skull. If we relieve the pressure, perhaps the person improves. No theory, no proof, no science. Just pattern recognition pushed to its absolute limit. And it worked often enough that the knowledge survived. But there was a problem. A massive, terrifying problem that would haunt surgery for the next 9,000 years. You could cut, but you could not stop the screaming. Here you are, on a battlefield. The air smells of blood and smoke, and something sweet and rotten you do not want to identify. A soldier is lying in front of you. His arm is mangled. The bone is visible. The flesh around it has already started to change color. You are the surgeon, and you have exactly one tool that can save him. A bronze saw. If you cut the arm off, he might live. The infection has not reached the blood yet. If you move fast enough and cut high enough, there is a chance. If you do not cut, he is dead by morning. Certainly. Without question. You pick up the saw. Here is what no one tells you about battlefield surgery in the ancient world. Skill was not what saved lives. Speed was. Roman military surgeons could amputate a limb in under 2 minutes. Not because they were gifted, because they understood that every second the patient spent under the saw was a second closer to death from blood loss and shock. The faster you cut, the more who survived. They timed themselves. They competed. 2 minutes, 90 seconds, faster. And even with speed, even with precision, even with leather straps to bite down on, and a strong drink beforehand, most patients who survived the saw still died. Not from the surgery, from what came after. The wound itself was the killer. The saw was filthy. The surgeon's hands were filthy. The battlefield was filthy. And for the next 1800 years, more soldiers died from infected amputations than from the injuries that caused them.
Surgery could cut. Surgery could amputate. But surgery could not stop what happened to the wound afterward. And nobody knew why.
Boston, October 16th, 1846. One of your patient is sitting in a wooden chair. He needs a tooth pulled. He knows what is coming, and his hands are gripping the armrests so hard his knuckles are white. You have done this 1,000 times. You will hurt him. There is no way around it. There is no version of this where he does not scream. But today something is different. On the table beside you is a glass bottle. Inside is a clear liquid called ether. You have heard rumors. People at social gatherings inhale it for entertainment and stumble around laughing. Sometimes they fall. Sometimes they hurt themselves and do not seem to notice until the ether wears off. You have been thinking about that second part. You look at your patient. You look at the bottle. You pour the ether onto a cloth. You hold it to his face. His eyes flutter. His grip loosens. His body goes completely still. You pull the tooth. He does not move. He does not scream. He wakes up 10 minutes later with no memory of pain. This moment in a dentist's office in Boston changed surgery forever. Before ether, there was a hard biological limit on what a surgeon could do. The patient was conscious. The patient was in agony. The patient was thrashing and screaming and dying of shock before the operation was half finished. You could not open the abdomen. You could not work on the heart. You could not do anything that required more than 2 minutes because no human body could survive the pain of anything longer. Ether removed that limit overnight. Within months, surgeons across Europe and America were putting patients to sleep before operating. For the first time in human history, you could cut into a living body without the patient fighting back. But there was still one final wall, the worst one. The one that had been killing patients since the first hole was drilled in the first skull 10,000 years ago, and nobody could see it, because it was invisible. London, 1867. A woman has been brought to you. She has been stabbed. Her abdomen is filling with blood. If you do not open her up and stop the bleeding, she will die within the hour. So you open her up, and she survives the surgery. And 6 days later, she is dead. Not from the wound, not from the blood loss, from something that starts as redness around the stitches and spreads and turns the wound black and fills the air around her bed with a smell that means only one thing. You have seen this before. Everyone has seen this before. They call it hospital fever, ward fever, the wound fever. It does not matter what they call it, because nobody knows what causes it or how to stop it. The pattern is relentless. The more invasive the surgery, the higher the chance of death, not on the table, days later, from the wound itself. And then a Scottish surgeon named Joseph Lister reads a paper by a French chemist named Louis Pasteur. Pasteur has discovered something. Tiny invisible organisms, bacteria, responsible for fermentation, for food spoiling, for milk turning. Lister makes a leap that his colleagues will consider insane. What if these invisible organisms are also responsible for the wound fever? What if they are getting into the wound from the air, from the instruments, from the surgeon's own hands? What if you could kill them before they kill the patient? He begins spraying surgical instruments with carbolic acid. He sprays the wound. He sprays the air in the operating room. His colleagues think he has lost his mind. The acid burns the skin. The smell is overwhelming. The whole thing seems like theater. His patients stop dying of infection. Suddenly internal surgery became possible. You could open the abdomen. You could remove a tumor. You could repair what was broken inside without the wound turning against the patient. 3 tools now existed that had never existed together before. The knowledge to cut. The mercy to put the patient to sleep. The understanding to keep the wound clean. And not one of them was planned. Every single breakthrough was an accident. A desperate gamble made by someone standing over a dying person with no other options. Now this is you back to your hospital bed. The scar is healing. The stitches will dissolve. The pain will fade. But here is what will not fade. Every surgeon who ever lived, from the shaman with the flint drill to the Victorian doctor spraying acid into the air, was doing the same thing, refusing to watch someone die without trying something. They did not have textbooks. They did not have clinical trials. They had desperation and love and an absolute refusal to accept that death was the only option. Surgery was not invented by geniuses in sterile labs. It was survived into existence by people who cared enough to try the impossible. And if that reframe lands for you, if seeing surgery not as science, but as 10,000 years of human beings refusing to let each other die, feels like something you needed to hear, then you are exactly who this channel was made for. There is a lot more where this came from, because the story does not end here. The scar on your stomach is not just a mark of healing, it is the end of a 10,000-year war